The most immediate tests, ones that you would see in the emergency room right off the bat for a fairly severe injury in the brain that has a bleed or something, would be your MRI, your CT scan. Those are going to identify immediate bleeds. But for the vast majority of traumatic brain injuries, they're not going to show up on those tests. They're not going to be a hemorrhage in the brain. So what we're seeing a lot, the biggest test that we see is a diffuse tensor imaging MRI, or a DTI MRI. And what that is, that's just a different form of MRI with some software that can really get in there and look at different parts of the brain and different things within the brain to help identify what's called a diffuse axonal shear or diffuse axonal injury, DAS or DAI. And those are injuries to the brain that don't show up on your standard MRI or your CT scan. That's probably, for an objective test, what we're seeing the most, and which is actually gaining a lot more acceptance throughout the scientific and medical community. The next would be, most people would probably lean towards a neuropsychologist. Now, we're not, a neuropsychologist is not an objective test per se where you show an image and you can see it. It's more of a written test. They can last anywhere from, really 2.5 to 7 hours, depending on which test they're giving and what they're trying to ascertain. So those two, a neuropsych evaluation and the DTI MRI, are probably the two most prominent. And then beyond that, you can have vision testing, you can have endocrine testing, all types of blood work to assess all types of imbalances that you may be experiencing. So starting at the top would be the DTI MRI, neuropsych evaluation, and then so forth throughout.